Hey, future nurses! Welcome back to another NCLEX breakdown. You know I'm passionate about helping you guys crush this exam, and today we're tackling a big one: physiological adaptation. This stuff makes up a solid 11 to 17% of the NCLEX-RN, so buckle up. Now, physiological adaptation is all about understanding how your body reacts to stress, illness, you name it. We're talking everything from heart attacks and strokes to infections and post-op complications. It's about looking at a patient and knowing exactly what's going on and how to act fast. That's why we're diving deep into NCLEX-style priority questions. These are designed to test your clinical judgment, your ability to think on your feet, and prioritize care in high-pressure situations. Trust me, mastering this skill is key to becoming a rock star nurse. So let's jump right in. Alright guys, let's talk heart failure. Your patient is showing signs of fatigue, shortness of breath, maybe some edema. All important, right? But then you notice something else. They're restless, confused, not their usual selves. This, my friends, is a big deal. Why? Because new onset confusion and restlessness, especially in a heart failure patient, can be a huge red flag for hypoxia. Remember, the brain needs a constant supply of oxygen, and when the heart isn't pumping effectively, the brain is one of the first organs to feel the effects. So what do? You need to act fast, check their oxygen saturation, assess their breathing, and call for help. This is a potential emergency situation, and you need to be prepared to intervene. Remember, in nursing school, they teach you to treat the patient, not the monitor. But in this case, the monitor could be giving you vital clues about what's going on. So trust your instincts, trust your assessment skills, and don't hesitate to escalate care when necessary. Early recognition and intervention are key when it comes to heart failure. You could be the difference between a positive outcome and a negative one. Fresh out of surgery, that first hour is crucial. You're monitoring vitals, checking incisions, making sure your patient is stable. But what happens when their blood pressure starts to tank? That's your cue to spring into action. Low blood pressure after surgery can indicate a couple of things. First, it could be a sign of bleeding, especially internal bleeding where you might not see any visible signs. Second, it could point to hypovolemic shock, which is basically the body going into panic mode because of fluid loss. So, you've got a patient with a dropping blood pressure. What's the first thing you do? You guessed it, check for bleeding. Examine the surgical site for any signs of excessive drainage or swelling. Also, monitor their urine output. A decrease can also indicate fluid loss. Next, call for help. This is not a time to be a hero. You need backup. Be prepared to administer fluids and medications as ordered to stabilize your patient's blood pressure. Remember, time is of the essence in this situation. The faster you recognize the signs of internal bleeding or hypovolemic shock, the better the outcome for your patient. Let's talk about chronic kidney disease, a condition that puts a lot of stress on the body. You're monitoring electrolytes, blood pressure, the works, but then you get a lab result back, and the potassium level is sky high. That's when alarm bells should be going off. Why is high potassium or hyperkalemia such a big deal in CKD patients? Well, their kidneys aren't functioning properly, which means they can't filter out excess potassium from the bloodstream. This can lead to serious complications, even cardiac arrest. So, what do? First, verify the lab result. Sometimes there are errors, and you don't want to jump the gun, but if it's confirmed, you need to act quickly. Notify the healthcare provider immediately. Depending on the severity of the hyperkalemia, they might order medications to help lower potassium levels. They might also adjust the patient's diet to restrict potassium intake. Remember, in chronic kidney disease, managing electrolytes is like walking a tightrope. You need to be vigilant, monitor those lab values closely, and be prepared to act fast if things start to go south. Chapter 4. Chest tubes and the dreaded drainage. Chest tubes, they can be a lifesaver, but they also come with their own set of risks. You're monitoring the drainage, the air bubbles, the whole 9 yards. But then you see it, bright red blood flowing continuously. That's your cue to jump into action. Now, some drainage is normal, especially right after surgery, but when it turns bright red and doesn't let up, that's a sign of active bleeding. This could be a serious complication and you need to address it immediately. So, what do? First things first, check the patient's vital signs. Are they stable or are they showing signs of shock? This will help you gauge the severity of the bleeding. Next, notify the healthcare provider right away. Be prepared to provide them with details about the drainage, the color, the amount, the consistency. They'll need this information to make decisions about further treatment. And remember, while you're waiting for the doctor, keep a close eye on that drainage. Mark the level on the collection chamber so you can accurately monitor any changes. You're the patient's advocate, and your quick thinking could make all the difference. Chapter 5: IV Morphine. When pain relief becomes risky. IV morphine. It's a powerful pain reliever, but it can also be a double-edged sword. You need to be on high alert for any signs of respiratory depression, which is a potentially life-threatening side effect. So you've got a patient on IV morphine, they're comfortable, pain is under control. But then you check their respiratory rate and it's only 10 breaths per minute. That, my friends, is a big red flag. Why is a low respiratory rate so concerning? Because it means the morphine is starting to depress their respiratory system. If it gets too low, they could stop breathing altogether. So what do? First things first, stop the morphine infusion immediately. You don't want to give them any more medication until you've addressed the situation. Next, try to stimulate them. Gently shake their shoulder, call their name, and see if you can get them to take some deep breaths. Sometimes that's all it takes to reverse the effects of the morphine. If they're still struggling to breathe, you might need to administer naloxone, which is a medication that reverses the effects of opioids. But always remember, naloxone is a temporary fix. You still need to monitor your patient closely and be prepared to intervene again if necessary. Chapter 6: Cirrhosis and the breathing struggle. Cirrhosis. It's a tough diagnosis, and it can lead to a whole host of complications. One of the scariest is ascites, which is a buildup of fluid in the abdomen that can make it really hard to breathe. Imagine this. You walk into your patient's room and they're struggling to catch their breath. Their abdomen is distended and they look really uncomfortable. What's the first thing you do? You got it. Prioritize breathing. Elevating the head of the bed can make a world of difference in this situation. It takes the pressure off the diaphragm, making it easier for your patient to expand their lungs and breathe. So grab some pillows, crank that bed up, and watch your patient's breathing like a hawk. You want to see their respiratory rate come down, their oxygen saturation improve, and their color return to normal. Now, while you're doing this, don't forget to assess their other vital signs. Cirrhosis can affect multiple organ systems, so you need to get a complete picture of what's going on. Chapter 7: Diabetes and the Confusion Conundrum. Diabetes. It's a balancing act, and sometimes things can go haywire, especially when it comes to blood sugar levels. You need to be ready for anything from hypoglycemia to hyperglycemia. Picture this. You're checking in on your patient with diabetes, and they're acting strange. They're confused, disoriented, and their skin is clammy and sweaty. What's your first instinct? Now, you might be tempted to reach for the orange juice and graham crackers, thinking it's low blood sugar. But hold on a second. Before you do anything, you need to confirm your suspicions. Remember the golden rule. Assess before you act. Grab your trusty glucometer and check their blood sugar level. It could be hypoglycemia, but it could also be something else entirely. Once you have that number, you can proceed accordingly. If it's low, then you can go ahead and give them some quick-acting carbohydrates. But if it's normal or high, you need to investigate further to figure out what's causing their symptoms. Chapter 8: Post-op Thyroidectomy, the Silent Threat. Post-op thyroidectomy. It's a common procedure, but it comes with some unique risks. One of the most concerning is damage to the laryngeal nerve, which controls the vocal cords. Imagine this. You're receiving a handoff report on a patient who just had their thyroid removed. The nurse tells you the patient is complaining of a hoarse voice and some difficulty swallowing. What goes through your mind? Alarm bells should be ringing. Hoarseness and difficulty swallowing after a thyroidectomy can be signs of laryngeal nerve damage or even airway obstruction. This is a time-sensitive issue that requires immediate attention. What do? First things first, assess the airway. Listen to their breathing, check their oxygen saturation, and look for any signs of stridor, which is a high-pitched sound made when the airway is narrowed. Next, notify the surgeon immediately. This is not something you want to mess around with. The surgeon may need to intervene to protect the airway and prevent further damage. Remember, early recognition and intervention are crucial in cases of potential laryngeal nerve damage. Your quick thinking could mean the difference between a patient breathing easily and a trip to the OR. So there you have it, future nurses. We just tackled some of the most challenging NCLEX priority questions related to physiological adaptation. Remember, it's not just about memorizing facts, It's about understanding the why behind the what. Think critically, use your clinical judgment, and trust your gut. The more you practice these skills, the more confident you'll become in your ability to handle any situation that comes your way. Keep studying hard, stay focused, and I'll see you in the next video.